Thank you, Vicki, and thank you all of you for allowing me to participate in this panel. It's so great to be able to have a conversation about not only healthcare reform, which is everybody's talking about these days, but to be able to focus in on the voices of children through these representatives today, and particularly the minority children who are being represented here. And I just wanted to clarify one thing. I'm not formally a member of the Tlingit Haida Council. I'm actually the formal council member, but I still belong to my tribe. And I know that gets confusing sometimes. Today I want to talk about a couple of things affecting Indian country, and I want to focus in on two areas. One is prevention and one is access. And part of that is because when we talk about the opportunities and we're focusing in on children being insured or uninsured, I just want to lay the groundwork here that Indian country receives most of its health care services through the Indian Health Care Service, through the federal government, through HHS. But all the studies have classified that the service that we receive is not equivalent to an insured program. Therefore, Indian children are technically uninsured. And so I wanted to lay that groundwork, and then I wanted to focus in on prevention. In Indian country, just like many of our communities, and certainly the voices that we've heard today, is basic health care for our children is not a luxury. It's not something that we can have options to, but particularly culturally relevant care, as we've heard, with language issues and other kinds of cultural issues, is an important option for us to be able to have. Our children in Indian country, and of course children are the most vulnerable of our community. 40% we still have a 40% rate of infant mortality in Indian country, and we have a youth suicide rate 3 times that of the national average. And prevention is virtually non-existent. We have severe underfunding of the Indian Health Care Service program, and so we have to focus our money and our resources on what we call life and death or life and limb. And those decisions are made by tribal leaders on a regular daily basis about who gets to live and who doesn't. And so very often the preventative health and the health promotion and disease prevention gets overlooked because of the shortage of the resources. And so we need to be able to address those, to be able to address the paradigm shift of healthcare that we're all seeking in healthcare reform. The other area that I want to focus in is just healthcare providers. We, like many other rural communities, have access issues to healthcare providers and physicians. And because it's hard to try to get a physician to want to come to our communities or to stay for very long, in many of our communities, we try to grow our own. We need those kinds of programs that give incentives for people to come back to their communities or to be able to work within their communities. But we also need an expansion of mid-level practitioners. I come from the great state of Alaska, come from the very small villages, and just give you a small inkling of what that challenge is. Just in the dental healthcare field alone, we have a shortage of over 50 dentists that we will never be able to get to the rural parts of the village. We were able to promote a pilot project with congressional support that allows for us to have a dental healthcare practitioners program, which means that we can do preventative healthcare or preventative dental care in those villages. It's a model program that should be looked at, expanding to other rural communities, as well as other kinds of mid-level practitioner kinds of access issues. We want to work with our other communities about having the expansion of community healthcare facilities and being able to have the appropriate certified physicians and mid-level practitioners to be able to address those issues. And we welcome the opportunity to join with the recommendations that Janet put forward. Those are recommendations we wholeheartedly can support, and we look forward to further collaboration with you and with this group. Thank you.